next presentation is by Dr. Amit Porwal on correlation of choroidal thickness with refractive error and axial length in Indian eyes.
So, good afternoon team UKSOS and AIOS. It's a privilege to be presenting in this session. So, I'm talking about correlation of choroidal thickness with refractive error in axial length in Indian eyes. We don't have any data in the Indian eyes. So, to briefly introduce, choroidal thickness is emerging as an important factor for predicting myopia progression. We are presenting normative data of choroidal thickness and its comparison with various refractive error and axial length in Indian population. So, the purpose of the study was to study the normative data of choroidal thickness in Indian population. It was a prospective non-randomized study in which 516 eyes of 258 patients were included. AIOLMaster 700 and Zeiss Angioplex OCT machine was used for measurement of axial length and choroidal thickness respectively. Based on the refractive error and axial length, patients were divided into three groups, that is emetrope, hypermetropes and myopes. Group emetrope with either or no refractive error or plus or minus 0.5 diopter with an axial length between 21.51 to 23.5 millimeters. Hyperope more than plus 0.5 diopter and axial length less than 21.5 millimeter. And group myope was with a refractive error of more than minus 0.5 and axial length of 23.5 and above. So when we look at the results, the mean age of the patients were 24.61 years. Male-female ratio was 146:112. Total emetrope patients were 88 with mean axial length of 22.14. Hyperopes were 56 patients with mean axial length of 20.81. Myopes were 114 patients. Out of this, a separate group of 22 patients with axial length of more than 26 and or refractive error of more than minus 6 diopter were made as high myopes. So mean choroidal thickness in emetrope, which was 176 eyes, hyperopes and low myopes was 270.15, 269.5 and 268.1 microns respectively. There is no significant difference between the three groups in the choroidal thickness. In patients with high myopia, that is axial length more than 26 or more than minus 6 diopters, the choroidal thickness was 221.17. So these were the measurements which were done on the AIOLMaster and the scans on the Angioplex machine. So coming to the discussion, in the early experiment on primates, it was found that in marmoset, the thickness of the choroid increases during postnatal eye growth. Superimposed on this developmental increase in choroidal thickness, there are changes in thickness that are correlated with induced changes in the eye size. Proseri et al. In the study found that myopic eyes have thinner choroids compared to emetrope and hypermetropic eyes. Choroidal thickness may in fact serve as a marker for myopic progression as choroidal thinning occurs early during the myopic development, but this association has not been established quantitatively. So in addition, the subfoveal choroidal thickness appears thicker in amblyopic eyes, while prematurity and retinopathy of prematurity may be associated with thinner choroidal thickness. Overall, both animal models and clinical research indicate that choroidal thickness induces or reflects physiological changes in the eye pertaining to ocular growth or maturation. So there is dramatic thinning of the choroid in high myopes, and associations are also observed between choroidal thinning and reduced vision and the development of retinal pathology associated with high myopia. In the short term, environmental factors known to be associated with myopia development and more rapid eye growth typically lead to a thinning of the choroid, whereas factors linked to slowing of the eye growth are typically associated with short-term choroidal thickening. So although a lot of emphasis has been put on this retinal thickness and axial length of progression of myopia, it is possible that choroid may have the answers for the same. In another report, choroidal thickness but not the retinal thickness correlated closely with the axial length and refractive diopters in Chinese children. Choroidal thinning occurs before retinal thinning early in myopia progression. So our study clearly shows when the refractive error is comparable, the choroidal thickness holds on. However, the axial length starts correlating with the thinning of the choroid once the axial length is around 24.5. So it would be imperative for future work to find out the critical anteroposterior size of the eye along with the choroidal thickness in the longitudinal follow-up of these patients or children. So to conclude, choroidal thickness in our study was comparable till axial length was less than 24.5, and with the axial length more than 24.5, it correlated with the choroidal thinning. So these are the references, and thank you.
Nice presentation, Amit.
Thank you.
So what take-home message would we give to the audience, Dr. Porwal?
So take-home message, basically what we are right now checking for myopia progression is only through the axial length. So we are checking the axial length, and if there is increase in the axial length, we are thinking that it is myopia progression, and then we start the atropine therapy or myopia control therapy. So before the axial length changes, the choroidal thinning occurs. So what we need to do is we need to check the choroidal thickness also along with the axial length. So if the axial length is stable, but if the choroidal thickness has decreased, then that is a sign that this eye is progressing and we should initiate the myopia progression therapy. And we have studies about this myopia progression choroidal thickness with the Western literature, but we don't have the Indian data of the choroidal thickness. So this was the first study done in which we had the Indian data of choroidal thickness. So this study is again continued. We have now, because it was very difficult to find high hypermetropes, the normative data. So now we have done 300 patient study in which 100 eyes of each section is taken. And we have found out that in high myopia, the choroidal thinning does occur, and that is an earlier sign than the axial length progression. So we should check the choroidal thickness to look for myopia progression.
Thank you. Thank
Thank
you.
you.
And he just came in after completing a live surgery and then gave
Thank
us a podium presentation. Thank you.
Thank you, Dr.